So we will have Miss Artie Hartwell from the Wellcome Trust to give some opening remarks, along with our unit head at the Climate Change and Health Unit, Dr. Diarmaid Campbell-Landrum. Then we will hear from UNDP on the climate promise. Following that, we'll have a representative from our Africa Regional Office, Dr. Brahma Koni, who will go into a lot more depth on the detail of the technical guidance that we launched on integrating health in NDCs. We'll then hear from a colleague, Dr. Pia Palomudu, on tools for estimating health co-benefits of NDCs. We'll then hear from our colleague Ali Ardalan, who will go into a little bit more detail on how we can start to estimate some of the loss and damages to health and include that in our NDC. We'll then hear a country experience from Nigeria on how they've managed to integrate health into their NDC. We'll have a facilitated discussion and Q&A, and then we will close the webinar and move on with our day. So thank you very much, everyone, for joining us today, and I hand over to Miss Artie Hartwell.
Thank you. Thanks, Amy, and thanks also for to WHO for asking me to provide some short introductory remarks. I promise I will keep it short. So as Amy said, I'm Artie Hartwell. I lead on climate and health policy at the Wellcome Trust, which is based in London in the UK. And I also just want to do a huge, the framework that Amy mentioned that was released at COP29 is so instrumental, but also just a huge thank you to WHO for all of the work that they do and have done in this intersection of climate and health as well. I think it's always fair to start by recognizing that this is quite a turbulent time for those working in climate and those working in health. It sort of feels like the world has become increasingly chaotic, and the environment in which we're all trying to do our jobs have become increasingly different. But as the world sort of accelerates its efforts to meet the goals of the Paris Agreement, it is increasingly clear that the climate crisis is just simply a health crisis in itself. And so where I wanted to sort of frame NDCs in that is it can actually provide some direction and the ambition that we want to see in this turbulent time. If we sort of zoom out and the whole process of UNFCCC around NDCs and the submissions of NDCs, it's a process around ambition and ratcheting up. It might not be as fast as we would like it or need it to be, but we're in a much better place today, and that's because of guidance produced by WHO. We're seeing that all countries are striving to do more in recognition of the urgent action that actually we must all take in itself. At Wellcome, we really strongly believe that health has got a really important role to play in this round of NDC submissions, and we sort of categorize it in three ways as well. So this is about NDCs providing a great opportunity for maximizing on the co-benefits of climate action. So here we're talking about cleaner air, healthier diets, more resilient cities, and healthcare systems. So recognizing the whole spectrum of health outcomes and impacts and the potential benefits as well. But also health can really raise ambition. So at a time where this feels like it's under threat, health has got a more important role to play in raising that action and making NDCs about people. It's not just about targets. It's not a plan about targets. It's about people with a human face. And we know that talking about health just naturally increases public engagement, for example, on climate issues. It increases support for more ambitious climate action to be taken, and it really builds on the support from across that political spectrum as well. And, you know, quite frankly, this has never been needed more than it has today. Health can also play and ensure a just transition for everyone. Climate change really poses an unprecedented threat to human health, whereas the action on climate change is an opportunity to actually build a healthier, a fairer, and a more equitable future for everyone. And actually failing to consider health within the climate actions risks worsening inequality and really exacerbates existing health challenges, as well as creating new ones. So a sort of call to action here is, if we're working in climate, for those of us working in climate change, everything is sort of urgent and everything is critical. But actually, this next round of climate action plans is really critical. It's critical for the climate, but it's also to get the world on track to keep to the 1.5 within reach. But it's also serving as a critical opportunity to protect and improve human health and build a much healthier, more equitable, and more just societies. So I thank you, and I look forward to the discussion later and all of the presentations as well.
Thanks so much, Auntie. Thanks so much for reminding us of why we're here, why we're developing the NDCs, and particularly for bringing forward that human face of climate change. And I'm really pleased now to hand over to Dr. Diarmaid Campbell-Landrum for some opening remarks from WHO.
Thanks so much, Amy, and thanks to the colleagues who've organised this meeting, to the Wellcome Trust who have just spoken before me. Thanks, Artie, and I'd like to pass on our thanks as well for your leadership, the Wellcome Trust leadership on climate change and health over several years, as well as being a financial supporter, also being a really engaged and leading partner on in this field, and most of all, of course, to thank everybody who's joined this call. And I don't think I need to reiterate the most important point that climate change is potentially the greatest health threat that we have. Action on climate change is one of the greatest health opportunities that we have, and we have to get collectively behind the drive to reduce greenhouse gas emissions so that we can maintain a livable future for humanity. So that's the big picture, and of course the NDCs are hugely important within that. They are the commitments that countries make effectively to the people of their country, the people of the world, future generations. It's the commitment of the effort that they will make in order to protect their future, but it is also a commitment to protecting their health. And if we do this right, enhancing their health even in the short term, because the evidence is very clear that if countries meet the targets that they've set through the Paris goals, the health gains that would come almost by accident by improved air quality, by more sustainable and healthy diets and so on, would actually pay for the cost of mitigation. So health is a really important part of what should go into those NDCs, those promises. And at WHO, we've been further accumulating the evidence on this. If you look at WHO's investment case, we document just for a few of the most well-evidenced interventions in climate and health, both on the resilience side and also through into healthy mitigation. If we implement those, if we roll out those proven interventions, we could save about 2 million lives every year, which is comparable to anything else that we can do in health. And the benefit to cost ratio of that is excellent. It's a minimum of $4 for every dollar you invest, probably much higher. So there's a real health opportunity and an economic and a development opportunity for including health within the NDCs. We also know that countries are really starting to get that message. So when we reviewed the first round of the initial nationally determined contributions, very few of them mentioned health. Almost none of them quantified those health benefits. But through, I think, the awareness raising that's gone on across this community, including through WHO, and we've given technical support to quite a few countries, countries have improved that. And the latest rounds of the NDCs, most countries are mentioning health, and a good proportion of them are now quantifying those health benefits. So we see real progress. I would also say that as well as elevating health within the climate change world, we're also elevating climate change within the health world. So most of you will be aware, I'm sure, that the next 5 years of the global health agenda, defined by WHO in partnership with member states, only defines 6 strategic priorities, and the first of those is climate change and health. And that's about to be given more detail in a global action plan, which should be endorsed by the World Health Assembly, hopefully, this month. We also are clear that we do this as WHO within a wider context, a wider UN system. And so our colleagues at UNDP, for example, lead the overall coordination of the NDC exercise, or the UN support to the NDC exercise across all parts of the economy. But it's our job as WHO and the health sector to provide the health expertise and the health input to that. And we have comprehensive guidance, we have training, and we have technical support in order to support that. So with that, I'd just like to once again thank you for joining, to reiterate the importance of this, and to pledge WHO's support, and now hand back to people who can provide much more detail on what that support actually is. So back over to you, Amy.
Thanks so much, Diarmaid, and I think the end of your intervention is a great segue to the next presentation. And I'm very pleased to welcome Ms. Suvi Huikuri from UNDP to speak about the climate promise and support to NDC 3.0.
Thank you, Amy, and good morning and afternoon. I wonder, Amy, if you have the slides or... Thank you. Yeah. So my name is Suvi Huikuri. I'm from UNDP's HIV and Health Group, working as a policy specialist on health and environment in the New York headquarters. I'm going to talk about the Climate Promise, which is the United Nations coordinated support on NDC enhancement and implementation hosted by UNDP, as mentioned. With the current political situation and funding uncertainties, and with climate change accelerating at the same time, it is more important than ever that we streamline our support to countries. And that's what Climate Promise is all about. And maybe the next slide here. Thank you. Thanks. I want to start by emphasizing why the health sector and other health actors, of course, need to be involved in the NDC development and where our support is needed the most. Extreme weather events caused over 2 million deaths over the past 50+ years, with over 90% occurring in low and middle income countries. This also impacts health sector's ability to provide care. And if we don't change our course, about 2 million people will be exposed to severe heat by the end of this century, with the global south, especially Southeast Asia, being most vulnerable. 90% of the 8 million premature deaths caused by air pollution occur in developing countries. Reduced air pollution is an important co-benefit of climate action. It means less disease burden and mortality, but also less health-related costs and improved productivity. And if you consider all the impacts of climate change, such as the loss of housing, income, food insecurity, and health systems interruptions, it is critical to link climate and health support with other development objectives, including the Sustainable Development Goals. If we do that, the NDCs can be one of the most strongest tools to advance sustainable development. Next slide, please. Climate Promise was launched 6 years ago to support the development of the second generation of NDCs. It supported over 85% of all submissions from developing countries. As a result, as pointed here, over 90% of countries raised mitigation ambition, over 90% enhanced adaptation, 96 included gender, and 97 addressed youth. So these are big numbers. Overall, the NDCs were of higher quality with better data, detailed costings, and linked to development and sectoral planning. Next slide, please. And why does UNDP coordinate the NDC 3.0 development? Last year, the UN Secretary General Antonio Guterres stated that ambitious NDCs are the priority for the UN system and asked UNDP to coordinate the work towards strong submissions. This made sense because UNDP has the largest climate portfolio across the UN system, but also because of our presence in over 170 countries, as well as mandates across a variety of sectors. One of our strengths is also the experience in supporting coordination and governance across existing initiatives and programs, including the SDGs. Now in 2025, the goal of the Climate Promise is to support countries to align the third generation NDCs to the goal of the Paris Agreement, strengthen their quality and investability, and accelerate their implementation. Around 90 countries at the moment are being directly supported through the Climate Promise coordination, and the number is increasing. And this time, countries are taking longer than expected to submit their NDCs because they want to ensure that all the critical pillars, partnerships, and connections are considered. And that is good news, and it's to thank for all the guidance that the UN family, including WHO, has provided. Next slide. And here we see the guiding principles of the climate promise. Ambition refers to high-quality NDCs with strong political will, strong targets, and alignment with other frameworks. Acceleration means, for instance, scaled implementation through access to technical support and finance. Inclusivity is important in the context of health, especially as it refers to strengthening human rights and the whole of society approach. And it makes sure that vulnerable groups, including women, indigenous peoples, youth, the elderly, disabled, and others, are meaningfully engaged in the NDC development. Next slide, please. And let me now explain who are the key actors of Climate Promise rollout and what they do. First, we have the UN system that has developed several resources to support the NDC update process. This ranges from data to policy advice, thought leadership, and technical and analytical support from agencies, including WHO, FAO, UNICEF, ILO, UN Women, and others. And we'll be hearing details about WHO's role in health integration later in this webinar. NDC partnership plays a critical role in coordinating and matchmaking NDC support across the implementing partners. It is a global coalition of almost 250 members to facilitate climate action and sustainable development. It also developed an important resource, NDC 3.0 Navigator, which is a one-stop shop for all thematic and technical guidance for countries on how to undertake the NDC revision. Then we have the regional economic commissions, such as those for Africa, Asia, and Latin America, who participate in the support, for example, by offering platforms of exchanging knowledge and providing policy advice at regional level. And lastly, but very importantly, the UN Resident Coordinator System and the UN country teams provide a national platform for coordination and high-level engagement with governments. Next slide, please. And then what are the processes that Climate Promise team can help with? The first step in the NDC revision is often the stocktake of the past NDC implementation. This is an analysis of the progress towards implementing the latest NDCs, and it identifies needs and opportunities for enhancement. The Climate Promise team also supports the use of the analysis tools and guidance, including the NDC Navigator I mentioned, and any other depending on country needs and priorities. The team also supports advocacy and outreach through coherent and strong UN-developed messages that the governments can benefit from. And it also communicates the latest science to encourage evidence-based decision-making. This sharing solutions, successes, and experience is really important as it will help to demonstrate what is already working in other countries. And lastly, in-country technical support and capacity building on NDC enhancement is provided from across the UN system. This focuses on coordination across sectors, target and activity development, policy alignment, and costing. The NDCs must unlock finance and be investable, so the last point is really important. And once the NDC is developed, the Climate Promise team is able to continue supporting the implementation of the NDCs as needed. Next slide. And this is my last slide, actually, which provides just some more detail on the partnerships. I also wanted to say a few words about how UNDP supports the integration of health into NDCs this year. UNDP's Climate Promise portfolio offers expertise in 15 sectors, such as energy, adaptation, carbon markets, inclusivity, nature, loss and damage, and more. Last year, health was added as one of these technical areas, meaning that our team is able to provide direct support across its areas of expertise that ranges from climate resilient and low emission health systems to air pollution responses, nature and health solutions, healthcare solarization, and smart health facilities that harness digital solutions. A specific area of support this year is around integrating air pollution and black carbon into the NDCs, which is enabled by the Cleaner Fund. Given that air pollution is becoming the biggest environmental determinant of non-communicable diseases, we see the urgency to reflect that in the NDCs. We are discussing with over 10 countries currently, hopefully soon more, including Ghana, Tanzania, Georgia, and others, that all have severe health burden from air pollution and black carbon. And we try to make the case why governments and the country teams should be considering black carbon and air pollution emissions. There are a lot of opportunities here, from clean cook stoves, sustainable transport, cleaner household energy, reduced burning of waste and crops, and others. And these are areas where the NDC can be enhanced. And after discussion with countries, we know that at this time there's much more awareness of the need to integrate concrete health activities, as Diarmuid also said, which has been fantastic. But still, many governments have questions around how exactly they can best integrate health in the NDC. And we'll hear from Nigeria on how they are approaching this question later. And having said all that, it's not the submission of ambitious NDC in the COP30 that will stop global warming and reverse the health impacts. What matters the most is their implementation. Especially during the current difficult political and financial environment, countries need to show a great deal of ownership over the implementation, be innovative, and be bold. And with this, I'm at the end of my presentation. Thank you so much, and over to the moderator.
Thanks so much, Suvi, and thanks for ending on that point about implementation. Thank you, of course, to all the previous speakers as well for highlighting the importance of integrating health in our NDCs. And now I'm really pleased to introduce my dear colleague, Dr. Brahma Konu, who will delve a little bit more deeper into some practical opportunities for integrating health in the NDC process and NDC documents and targets. Thank you, Brahma.
Thank you so much, Amy. Dear colleagues, shall I share my screen right now?
Yes, you can. You should be able to do that.
Let me do that and share it. Can you see it, please?
You can see it, not yet in presentation. Yeah, now, perfect.
Wonderful. So, yeah, I will try to deep dive a bit on how to consider health in national determinant contribution, how to integrate health in national determinant contribution. And yes, let's start by acknowledging the great work of Amy and colleagues at HQ on this one. And even this presentation I'm going through was designed by her hard work also. So we will start by, you may all be aware of that, but it's always good to come again on it. What does it mean, national determinant contribution? You may be aware that at the COP 21 in Paris, the main outcome was to support countries so that we keep our emissions under 1.5 to 2 degrees Celsius compared to the pre-industrial level. Meaning that all our emissions should not lead to an increase in the earth temperature that is going far from 1.5 to 2 degrees Celsius maximum. We should keep it above this level. And this is calling from many efforts from countries to reduce their greenhouse gas emission. So the NDCs are all the efforts countries are taking to keep under, to set emission targets that will keep the world under an increase of 2 degrees maximum above the pre-industrial level. How this process is led, the integration of health in the whole UNFCCC processes, but mainly in the NDC's processes. As you may be aware, all the climate-related issues are mainly led by the ministries in charge of environment in the countries globally. For these ministries to work with other sectors so that their voice is being heard. So when it comes to the integration of health, this is mainly or shall mainly be led by the Ministry of Health, working with other sectors. So by doing so, the Ministry of Health may be able to come out with comprehensive targets and actions that are honored by other sectors, that are led by other sectors in collaboration with the health sectors. As you know, the determinants of health are multisectoral, going from transport, industry, to other sectors like agriculture. So while the Minister of Health may be leading the integration of health, each sector which is leading a health determining factor may contribute to that process. And you may see here the timeline and the that we call the NDC ambition cycle. The last flow of NDCs were supposed to be submitted in 2020. And from there, 5 years later, they need to be renewed. So we are actually in 2025 supporting countries to come out with their new NDCs considering health in these ones. And between this cycle, the submission cycle of NDCs, we do also have a global stocktake process that are coming to evaluate all the achievements that have been made in reaching the Paris Agreement, the Paris target. And based on the outcome from the global stocktake, if need be, new recommendations can come towards member states in the way they design their NDCs so that we've been able to reach, at the end of the day, the Paris Agreement targets. So now we are waiting for the new NDCs to come, and the following one will be coming in 2030. And those NDCs from one submission period to another one, member states may increase their ambitions, revise their ambitions, so that it came with the most impact possible, depending on achievements that have been made from the previous NDC. I think many of you may be useful, may know, may be used to this picture that is coming from how WHO is supporting member states to build climate resilience and sustainable health system. You have these 3 pillars. One on strengthening the climate resilience and decarbonization of the health system and facilities. The other one on addressing the wide range of the impact of climate change on the health system. And the third one on promoting health co-benefit for climate change mitigation in other sectors. All health determining health-related sectors. WHO developed it then a guiding document for member states so that they can consider health, they can effectively consider health in the national determining contributions. And this guiding document came with different steps, 7 steps, starting for leadership and enabling environment, setting a leadership and enabling environment to an implementation stage through the national circumstance and policy assessment, the mitigation, the identification of mitigation options, of adaptation options that all consider health and contribute to NDCs. Also, the contribution of loss and damage in achieving the NDCs, and for sure, the financial need to implement the healthy NDCs. So let's go a bit deeper in each of these stages for you to get what is it about. Setting a leadership and enabling environment. We are suggesting in this guiding document that the consideration of health in NDC is being led by the Ministry of Health. That is calling for an active engagement of the ministries of health in the NDC processes, and it shall be climate-informed planning and programming. That is looking at the key health determining sectors. As I was saying, we all know that health is a transversal issue. So all the health determining sectors need to be considered and need to be put together under the leadership of the Ministry of Health. So this is a cross-sectoral process. As the most cross-sectoral coordination mechanism you put in place, the best leadership and enabling environment you may get in your process. And that is also calling for coherence between national climate change and health policies and process in the country. So yes, first criteria, first step to set up a leadership and enabling environment for your NDCs to better consider health. Moving to the national circumstance and policy assessment. We know that the population health and well-being is the ultimate goal and guiding principle of the NDCs, and we need to push for that. Whatever thing we are doing, the ultimate goal is our health and well-being. And that is why it's fundamental that it's been reflected in the NDCs. And to do so, we need to describe in each country the national health context, how the health determining sectors are connected to each other, how the existing health policy and priorities are settled, how are they relevant to climate change, and how the health legislative and regulatory mandate are settled considering climate change. And the identification of health as vulnerable to climate change and the quantification of current and projected risks need to be done through traditional process we are supporting member states with, starting by doing the vulnerability and adaptation assessment of the country, by drafting a health national adaptation plan, and by supporting member states to integrate this health national adaptation plan in the whole country national adaptation plans. And through this process, the vulnerability, its quantification, and the quantification of adaptation option is made in the current situation and in the future. And this need to be strengthened, and this need to be considered when we are looking at the national circumstance and policy priorities that need to be considered in the NDCs. From there, we now move to the mitigation component. As you clearly see it from the definition of NDC, is how we contribute to decarbonizing the world. So the mitigation is one of the key components. And how can we consider it in the health sector? Firstly, through identifying health co-benefit actions. These are the actions that are improving our health, but that are also decarbonizing the health system and decarbonizing all the determinants of health. While having identified those mitigation actions, we need to quantify the health co-benefit of these mitigation actions as they are key health determining in the key health determining sectors. And there is a special call to prioritize air pollution and short-lived climate pollutant reduction, including the standalone health-based target for reduction of air pollution. Because, as we know, all health-related determinants of climate change are doing it through air pollution. So we need to prioritize the air pollution and short-lived climate pollutant reduction when we are looking at mitigation actions. And we need to establish emission reduction targets that will help us plan a good monitoring and evaluation process. Because without target, it may be difficult to get a reliable monitoring and evaluation process. So we need to establish clear targets for the health system that we will monitor and evaluate during the implementation stage. So let's focus a bit more on the health co-benefit and the quantification of these co-benefits. So, as we know, the public health gain from mitigation actions far outweigh the cost of these actions. So we need to improve decision-making on investment, and they help improve the mitigation action, help improve decision-making on investment for climate action. It helps provide strong argument for transformative change and increased ambitions. These are key tools we are advocating with that have been settled by WHO and partners to support member states, estimate the health and economic gain from domestic carbon reduction through the ClimateH tool, or calculate the health effect of long-term exposure to air pollution through the Air Quality Plus tool, or even calculate the health benefit and economic impact of increased urban walking and cycling through the heat tool, or using the BAHAP tool to assess the cost and benefit of different interventions for cooking-related household air pollution. And for all these tools, we developed guiding documents that can be used by member states. Let's look a bit here to the example of Colombia. The health co-benefit assessment of Colombia NDCs. They use mainly 3 tools to estimate the health co-benefits of reduced air pollution associated with the NDC implementation. And the report shows that a carbon dioxide carbon reduction of approximately 58% by 2030 could prevent more than 3,800 premature deaths annually and save approximately around 2 billion USD annually. This is clearly showing how having reliable, healthy NDCs may increase the financial gain while also decarbonizing the health system. And the report also highlights that through the higher mitigation scenario, that 20% greater health and economic benefit will be gained compared to the lower scenario. After the identification of health co-benefit actions for mitigation and their quantification, there is a need to prioritize air pollutant and short-lived climate pollutant reduction. And why this is important? Because almost 90% of people breathe outdoor air that exceed the WHO guideline limit of air pollutants. And many of those air pollutants contribute both to global warming and negative health outcomes. So the air pollution reduction target will then deliver large health benefit and also reduce greenhouse gas emission. When you take, for example, the case of walking and cycling, while it decreases pollution coming from transport, from urban transport, through cars and train and whatever being, the material used that consume fossil energy, walking and cycling improve your health, your well-being condition, while it's also protect from the gas that will have been emitted through traditional transportation in urban area. The last quality criteria for mitigation is to draw emission reduction targets, that will be needed for the monitoring and evaluation during the implementation stage. And what is it important to have clear target of reduction? Because it has been documented that the health sector is responsible for more than 5% of the global emission. So there is a need to decrease this emission. And doing so, there is a cost efficiency and resource optimization gain. Decrease healthcare costs while reducing emission and bolstering health co-benefit. Why is it also important? Because while doing so, we are also considering the common but differentiated responsibilities and respective capacities that will help us not only focus on mitigation globally, but also consider how each country, based on its system and its economic financial context, can contribute to the mitigation. So the target may differ from one country to another one. But globally, for countries that do have very reliable health system, and I would say good or acceptable financial conditions, it's highly advised that these countries reach a net zero stage by 2050. The fourth stage of our guiding document is related to adaptation. And I think this is one of the aspects the most important for the developing world. As we used to always say, many developing countries are contributing few to climate change, but are bearing the highest impact and consequence from climate change. So adaptation is highly needed, and it's then a priority outcome for the health sector. While looking for adaptation options, we need to bear in mind the need for these adaptation options to be phrased, to be organized in such a way that their contribution to the NDCs being coherent. So the NDC complement and then support national approach to adaptation planning and implementation. They are not opposite. They shall be done in such a way that national adaptation plans be totally coherent and even supportive of the NDCs. So the integration of health in the adaptation target for health determining sector as a whole is needed. And we need to identify synergies between mitigation and adaptation for health. When we were talking about the co-benefit, there is clearly there synergies. When we are looking to other health determining sectors, we need to clearly identify where are the synergies between the mitigation actions that are requested from these sectors and the adaptation for health sector. Now look a bit to the fifth stage in the process, is also to consider the loss and damage. And as we know, this refers to the destructive impact that cannot be or have not been avoided by mitigation or adaptation. So it's what is going beyond our capacity to adapt or to mitigate. And these loss and damage are grouped in two. We have the economic losses that are the loss of resources of goods, service, typically traded in economic market. For example, the infrastructure, the property damage, the decrease in crop yield. But we do also have the non-economic losses that are not otherwise commonly part of economic market at the individual, social, societal, or environmental level. And they include, for example, the loss of life. We cannot economically give a value to loss of life. The loss of health, not loss of health, cannot be quantified in terms of economic loss. For sure, looking for care can be evaluated in terms of economic loss, but the loss of health itself may, in some cases, not be evaluated in terms of in economic terms. The displacement of population, for example, lead to an extreme event like flooding, like heat wave, like drought. All these things are not systematically, cannot be systematically put on the economic market and then not being evaluated as economic losses. But anyway, there will be another presentation going more in detail on the loss and damage. But let's here present some quality criteria related to loss and damage. It helps quantify climate-sensitive health risks and outcomes, including health system and facilities. And we also need to quantify the financial implication of health-related loss and damage, and to include priority intervention that will advert, minimize, or address the loss and damage to health and the health system and facilities. By doing so, we will get a more complete, healthy NDC. But when we finish, let's show here one example of NDC from St. Kitts and Nevis, a report of 2021. For example, economic and non-economic loss and damage was presented here. For example, the damage of health infrastructure, the rise of vector-borne and waterborne diseases, the mental health issue, the decline in labor productivity due to extreme heat. But some other non-economic loss and damage were, for example, the loss of culture, the loss of lifestyle, of tradition and heritage, the negative impact on physical health, on mental and emotional well-being. These are kind of things really important, but that cannot be considered in the economic loss and damage, and need to be considered as non-economic one.
Hi, Brahma. Really sorry
Yeah.
to interrupt. We're just a little over time. If maybe just for the last couple of sections of the quality criteria, if you could go just a little bit faster, maybe in 3 minutes or so, that would be really great.
Perfect.
Thank
Perfect.
you.
Let me do so. So the finance, whatever being your NDC, the before implementation, the issue of fund is one of the crucial one. So we need to estimate how much will cost the NDC and where are the potential to finance this NDC. What are the local capacities? What are the funds that will be needed from outside? But anyway, we need to estimate the cost and to specify how we could get these funds, and use health impact and indicators as basis to prioritize the investment in key health determining sectors. And when that is done, we now come to the implementation. And one of the main things to do during the implementation is to translate the target in clear action points and to monitor and evaluate the implementation of these actions. Why this is it important? Because it helps achieve the health target, and as I was saying, the monitoring an evaluation of this process is almost needed so that we know exactly what has been done and what needs to be planned for the new NDCs to come. I will jump on this example from Ecuador and say that in this document, you will see a checklist, a healthy NDC checklist. These are guiding questions. These are guiding checklist indicators that you may want to use and adapt to your context, but in any way, it will support coming with reliable, healthy NDCs. And for more information, you may visit the Alliance for Transformative Action on Climate and Health webpage, where you will see additional resources for your use. And I think I'm done. Thank you again for the time, and sorry for taking a bit more time than planned. Over to you, Amy.
Thanks so much, Brahma. Thanks for that very clear presentation on the quality criteria, and there's a lot of content there, and of course there's even more content in the guidance itself. So if there are any specific areas of the guidance that you would like further training or webinars that we could organize so that we have a little bit more time maybe to go into depth on some of those topics, please do let us know, and we'll put the email address in the chat, and we would be happy to organize some future webinars. Without further ado, though, we'll move on to the next speaker, who will build on what Brahma has shared with us about the health co-benefits of climate change. And we're very lucky to have Dr. Pier Paolo Mudu, who will be talking about some of the tools and approaches for estimating and quantifying those co-benefits of mitigation actions.
Hello, can you hear me?
Yes, we can. Thank you.
Okay, and I'll start sharing my screen. Can you, is visible my screen, the
Yes.
presentation?
Yes,
Okay.
it is. Thanks.
Okay, thanks for the previous speakers that I think they really gave a lot of information, background information about something that now I'm going to present. So my name is Pier Paolo Mudo. I work for the WHO. I work for the headquarters and for the Bonn office, that is on the office that works on environment and health. So what I'm going to present quickly, I will take 10 minutes of your time, is an introduction to the ClimateH tool. It's a software that WHO has developed. Before Brahma was in a slide was presenting some other tools that WHO has been developing along the years. There was HEAT for walking and cycling, BarApp related to household air pollution, then RQ Plus and ClimateH. So for those of you that are familiar with the ideas of quantifying the health impacts of interventions, actions and related to the environment, now ClimateH will be something that I would say will be easy to catch. And my presentation is really quite short. It's really an introduction on this tool. So ClimateH is a climate mitigation and quality and health software. It's we can call it a decision aiding tool that was developed by the WHO European Centre for Environment and Health, with the aim to screen among carbon mitigation pathways that are considered by member states in their NDC proposals to the Paris Agreement. And it does so by comparing the health and economic co-benefits of climate policies over the near term that is 2030. And the other objective of the software is to encourage users to collect data that are relevant to do this kind of quantitative analysis. And the software, and this will be my third bullet point in the next slide, it was designed in a way that simplify a little bit the collection of data that you need to do to run this kind of modeling. For those of you that are familiar with modeling pollution and climate pollutant data, you know that the available software, they really need a lot of input data, a lot of work on getting different emission factors and concentrations and etc. So climate H, we design it in order to have this a little bit more simplified. And then here I put another point that is quite relevant, is the fact that this software was at the beginning was designed also to be an educational tool. So a tool that could be used to introduce people that work or are interested in climate change to understand the principles of the health impact assessment of interventions of policies or modification of business as usual. So trying to think, we try to think when designing the software to have a broader audience than just the audience of a public of experts. So the third point again repeats what I was saying, that we wanted to have a software that could be simple since the beginning for the users, and I will show what I mean simple from the beginning to the users. Although the software obviously it's has a scientific rigor because it produces the same kind of output that can be produced by much more sophisticated software, and can be used in a simple, I would say, for simple output or also for more advanced output. And the last point, again, about the fact that we want to have a wide audience, that we put some preloaded country-specific default data. So users that have no data can find some information without going around and in the internet just randomly trying to find some data. So this also gives an idea of the order of magnitude and the figures that are related to some parameters that are used in the analysis. The last point before going a little bit more in detail of climate H is the fact the software can be used alone in your computer. It's a standalone application. It means that you don't need to be the administrator of your computer. You can run it just downloading it, unzipping it, and using in your computer or in a USB drive. I have also a slide repeating this concept that is quite important. This is the web page of the software where you can find the software. I will leave my slide. So if you Google anyway, if you go on the internet, you find the climate H is the first entry that appears. So anyway, this is the link, and this is the web page that is designed with some text to explain what the software does. And then there is the way to download the software if you have different platforms are welcome. So Windows, Macintosh, and Linux. And then there is a manual also available in the web page. And I have now the next slide is on the manual. Just quickly going to the manual. And also on the right bottom of the page, there is the possibility for people that have run that they use a little bit the software to do a survey and share with us their way of seeing things, if we made mistakes or according to them, or if there are things that they don't like or things that they like, so they can share all their opinions with us, and we take them into account. So this is again to repeat something that in the web page where you can download the software, you can find a manual that we have been working a year to have a simple manual that in 30 pages. I think the manual is 50 pages. I don't remember. We wrote it a few years ago, but I suggest to download the manual first before the software. So with the manual, you see there are examples. There are examples of analysis that you can do. There is a clear explanation of what the tool can do and what the tool cannot do. And again, the user survey is also available in the same web page. This is the climate H welcome screen. So once you download it, if I'm not wrong, it's around 47 megabytes. So 50 megabytes is not a big thing to download. you unzip it, and then you can use it also independently from having admin rights on your machine. You can use it in USB pen. You can unzip it there and use it, so you don't need to do any install in the machine. This is the welcome screen. I was mentioning before that we have a traditional work with other tools, and the most famous one is RQ+. That is the most used tool for the calculation of health impacts over pollution. And Climate Cage has a history that I was developing in 2018 in Excel, and it was called Carbon Age. But then and the Excel was a little sophisticated. There was a lot of worksheets and tabs, and it was we realized that the users had some difficulties in approaching these kind of calculations. So we decided to go in the direction that we had already with RQ+ to check with the users what kind of features, what kind of expectations they have when they use this kind of software. So the users that are not the super experts from Stanford or from Cambridge, but the users that are in a municipality or in a government or in a school even. So based on that, we decided to have an interface that is similar to the one that is for RQ+. For the people that work with RQ+, this is a similar kind of welcome screen where you can get the glossary. So you have the key terms explained. It's on top on the right of the software. Then in the middle, you have an explanation, quick explanation with just 2-3 paragraphs on what this software can do and what kind of data you need. And then on the left, you just work with your projects. You see on the left on that you can work at a single country level, you can work at a multiple country level, and you can work at a regional level. So this means that the software so far has been calibrated to work at a country level and not a subnational level. It's the same for BARHAP, different for RQ+ or for HIT that can work at a different scale. And once you have downloaded the software, you have read the manual, at least you just had a quick look, you have to think that the main question that to be addressed by this software is that what health and economic benefits could be achieved by implementation of the climate policies in the NDCs that a country has declared. So this is the main question that this software is addressing. And this the software, let's go a little bit more in detail before the conclusion, works through building scenarios, so to building different also alternatives, so to building the best options that are available or business as usual. So this is something that you have to keep in mind, because they're one of the most relevant discussions that you can have with policymakers, for example, or with stakeholders. What kind of scenarios you are envisioning for the next few years, for 2030 in particular? And these are scenarios usually, obviously, hopefully, of emission reductions. And the estimates then are for climate pollutants, and we work with the PM2.5, and we do not only work for the health aspects. We also have a calculation for the economic benefits. So the software, again, I'm repeating here what I've said before, that there's for the European region, so for 54 countries, we have default values that were inserted in the software. And but the software allows also calculations outside the European region that goes from Portugal to the Central Asia and from the north of Europe until the Mediterranean countries. So 54 countries, but obviously the planet has more than 190 countries, and there is the need to apply this software outside the usual part of the world. So the software was applied by colleagues in two different calculations for two different countries. One is Colombia, and the other one for Pakistan. So Pakistan, a country where we had a huge lack of data. So there was a situation that I would say quite extreme for some aspects, but it was very important that after months of analysis of data, of hypotheses on data, we could produce, I would say, a very significant number, estimates of 65,000 deaths that annually can be prevented in 2030 if there is the greenhouse gases emissions are accompanied with significant air quality improvements. And this is 65,000 deaths is a big number, because in the case of Colombia, where we had more data, although we had to do a modeling with a LEAP IBC with other software for the emissions, we had 3,800 premature deaths. And the calculation for the cost of this, in economic terms, of these premature deaths are impressive. For Colombia, are on the orders of $1.9 billion US dollars, and for Pakistan, if I'm not wrong, was $11 billion. So this is a part of the GDP of 0.64% of Colombia GDP projected in 2030. In the case of Pakistan, if I'm not wrong, it was a little bit more than 1% of the GDP. We are talking about substantial numbers and figures that when you have discussions, these numbers, these figures are quite impressive. I have my last slides where I wanted to show you some applications, some use of the software outside WHO world, if you want, but taken by other scientists. There was a year ago, there was a report that was published by scientists in Ireland about the health impacts of climate change and mitigation policies in Ireland using climate age. So I suggest you also to have a look at this report. It's well written, it's long, but it's exactly what is needed to do. And then we have some of the most famous scientists that have been working and helping also on for the software, and they publish for the Lancet Pathfinder Commission recently a paper a year ago that is very, very well written paper, where there is an entire paragraph dedicated to the climate cage, to the use that can be done for with climate cage. I put here the paragraph for the most for the laziest people here in the audience, so you can read it from here. You don't need to go through the paper, but I suggest to go through the paper. Check also a work published by colleagues at the Joint Research Center of the European Commission. Recently, they did some work on Western Balkans countries, and again they use climate cage. So I can stop here. I think I gave you really an introduction of a work that we have done in the past few years, and for those of us that know this work is really based on evidence, based on the work that we do with the most famous scientists in the field. So I really thank you for your interest and attention for our activities. Thanks again.
Thank you so much for joining us, Pierpaolo. Really interesting, and we'll put some of the links in the chat, and hopefully this will be useful to countries who want to estimate the health co-benefits of their mitigation actions, and hopefully enhance the ambition of their NDCs going forward. And I'll move on to our next speaker. I'm pleased to introduce Dr. Ali Adolem from the Health Emergencies Department in WHO, who'll be presenting on loss and damage to health and estimating loss and damage. Ali, if you would like to.
Thank you so much, Amy. Just let me to share my screen. Can you see my screen?
Yes, we can. Not yet in presentation mode, but we can. Yes,
Yes.
perfect. Thank you.
Okay, thank you so much, and appreciate for organizing this important webinar, and also including the health systems and health emergency work stream of WHO as well. What I'm going to present would be an introduction to how the loss and the damage assessment can be done following actually extreme events or slow onset events in the context of the climate change. So the whole idea of this assessment is around the gap analysis of comparing the situation after the event with the before. And the key point and key word here is the baseline data that usually is challenging to set up and agree on. You see in this slide developed by UNDRR, UNDP, and WMO, that when it's actually in the context of the extreme event, usually the baseline situation is more clear. However, in the context of the slow onset, it's more challenging. And in terms of the agreeing on the time period, agreeing on the and availability of the data needed for the target indicator. Usually the loss and assessment exercise have been done under the actually the health system recovery agenda of WHO, and contributing in a process called post-disaster needs assessment that is a tripartite, based on a tripartite collaboration, a strategic collaboration between EU, World Bank, and United Nations. And UNDP actually is the lead agency from the United Nations side, while all the specialized agencies are involved. And the result of this tripartite collaboration, as I mentioned, was a methodology called post-disaster needs assessment, that also has a shorter version called rapid disaster needs assessment that can be done in some settings. But the whole idea is that assessing the damage and loss to inform development of a recovery strategy that will lead to development of the recovery framework and detailed action plan. The PDNA methodology includes actually the context analysis, assessing the disaster effect, disaster impact, the recovery needs, and as I mentioned, developing the recovery strategy. There are 4 categories of the sectors that are considered in this PDNA, including productive, social, infrastructure, and cross-cutting. Cross-cutting, the environment actually is considered as one of the most important cross-cutting sector, and health is aligned with the other the social related sectors, including housing, education, and culture. Damage and loss in a simple language I want to present. Damage addressing and referring to the total or partial destruction of infrastructure and physical assets. So it's about whatever is physical, has a physical nature. Its cost is estimated at the replacing or repairing market prices prevailing just before the disaster. And it's valued first in physical terms, number, for instance, number and type of the health facilities, and then in terms of their monetary value. It's kind of the actual economic effect of that event that can be usually is an extreme event and is somehow not always straightforward. When it comes to loss, is a bit more complicated. However, it's all about whatever is not physical and includes the changes in the economic flow. That change in economic flow can be because of the extra expenditure following that event, or can be because of the loss of the revenue. For instance, some of our health facilities, hospitals couldn't continue their operation. They had to cancel surgeries. The income for sure decreased because of that disruption of the services. This is the part that can be estimated from the economic perspective. So it's a kind of the economic loss, referring to change in economic flows arising from that disaster. Duration change in the changes in the flow changes depends on the nature of the event, the recovery process, and until that full economic recovery and reconstruction has been done. This can happen in some countries that actually already are in the protracted conflicts for decades, such as Syria, Afghanistan, Sudan, Somalia, etc. This loss that I mentioned, this category of loss, is expressed in current monetary value. If I want to summarize until here, the damage is about the destruction of infrastructure and asset, and what we estimate is the cost to reconstruct, replace, or repair the infrastructure. For the loss that is related to non-physical but has economical implication, can be categorized to three. The first one is the functions and the loss of changes in the economic flow due to the extra cost for governance and decision-making to respond to that event. For instance, establishing coordination mechanism, whatever is needed, whatever we do under the response and the recovery planning, as well as increased costs for disaster-related information and surveillance system. The second category of the loss is about the addressing disruption of the services and increase the health needs that we have more, for instance, injuries, maybe some cases for that can be related to the third category, that's increased risk, such as the outbreak of diseases or some environmental risk. A slow onset event actually has its own particular nature. They usually don't lead to destruction of health infrastructure and assets. However, we need to invest on the health facilities to make them more climate resilient. What they do with the health service utilization, usually they increase the burden of some diseases that at some extent lead to increase referral to the health system and the cost that the health system to compensate. Governance and decision-making, the third dimension of the loss, we need to address the slow onset event with developing and implementing climate change adaptation plan. It has its own cost. That what we always promote and advocate to be integrated in the all hazard health emergency disaster risk management frameworks and those related to health security. And also we need to strengthen the monitoring and information system to support adaptation to climate change. And also we need to manage the health risk related to the slow onset events in terms of the adaptation to changes in transmission of the pattern of the diseases, environmental risk, and potential outbreaks and epidemics. And also for those that have malnutrition consequences, as well the increased cost of the care for those patients should be considered as well. In addition to what we have the actually economic loss, we also face with the consequences that not necessarily calculated with monetary value, and it's called non-economic loss. For instance, increase in burden of diseases that can be estimated in dollars, or delays or disruption in meeting health related SDGs, or the specific national health development goals and targets. Here I want to emphasize that while that dollar can be translated to the monetary value, however, all those extra cases will not refer to the health facilities necessarily. So the national health system is not going to pay directly for those cases. However, in general and in long term, it has economic implication for the whole society and country. And it's very important to, anyway, what we discuss, we consider addressing the climate adaptation and of the climate to climate change and the mitigation as an opportunity for resilience building. And when it comes to the recovery as an opportunity for build back better along with many other initiatives. For instance, here with the following and implementing the methodologies for climate resilient health facilities, modernizing those facilities, etc. And other examples of the Build Back Better can include addressing possible pre-existing constraints in coverage and performance of service delivery, strengthening the information system, and improving all hazard disaster risk management capacity in MOH and national emergency medical teams and system. Thank you so much. Over to you.
Thanks so much, Dr. Adnan, for that introduction to loss and damage to health, and understanding what that means, and also estimating some of those costs, some of those loss and damages to health, so that we can integrate those into the NDC. Now we're very lucky to have a colleague from our Nigeria, WHO Nigeria country office, who will present to us the process and some aspects of taking this process of integrating health into the NDCs to the national level, and how they've managed to include health in their NDC. So Edwin, I hand the floor over to you, and I'll set up the screen sharing. Thank you.
All right, thank you, Hami. Thank you, colleagues, for your attention. All right, I think Professor Brahma and the previous speakers have provided a laudable opportunity, insight into the background to this work. And my job here is very simple. It's a very, it's slide is a short presentation, and I just want to share with you some of the lessons I have learned, our team have learned, given the Nigerian experience of integrating health into the climate NDC. Great. All right, so all right, thank you. This is a sort of background. Like you know, Nigeria is one of the countries that has signed into the Paris Agreement on climate change years back, 2015. And during that same period, we developed the first NDC as a country, leveraging from bringing all different stakeholders and different sectors together. And thereafter, in 2021, that NDC was updated. But the first two NDCs that were developed in the country has some gaps in terms of incorporating health. It's missing. The health context is actually missing in the NDC 1.0 and 2.0 developed in Nigeria. However, like we all know that the health sector, of course, is the human face of climate change. And we can see from that picture is a state in Nigeria, Kogi, which was submerged by flood, and of course, which also offset activities within the health system. In terms of context, we are a country with over 210 million people currently. 29% of the national burden of disease in Nigeria is attributable to risk factors from the environment, with principally climate change contributing about 21% from the VHA report analysis we've done. You can also see that an average person in Nigeria generates 3.37 metric tons of CO2 equivalent. That is our per capita CO2 contribution, which is a bit lower than the global average of 4.7. And there are different predictions, especially for cities within the coastal region of being predisposed to climatic risks from flood, and also down towards the Sahel, heat wave, and so many other issues that relate to determinants of health. Great. All right, so here are some bold steps we've taken to ensure that health is properly integrated into the climate NDC. The first step we've taken is actually to review the last NDC, the updated NDC, which was in 2021, and we identified that there is a clear gap. Health was not even mentioned at all. So we are doing this together and also looking at the new tools that WHO have developed on NDC guidance and so many other climate framework. That was the first step we have taken. And then we start engaging with the national designated authority, the NDA for climate change in Nigeria, which is the NCCC, the Nigerian Climate Change Council, together with the Ministry of Health, Environment, and some key partners, to really raise the issue that there is a gap for health to be integrated into the NDC plan. And then thereafter, we have to forge more like a multi-agency partnership, working and discussing with the UNDP, with the UNICEF, the FCDO, FAO, to ensure that we galvanize actions from different agencies. And one interesting part of all of these bringing agencies together is that we see a lot of nexus. For example, under the water sanitation aspect, which UNICEF is championing, there is a core component to make sure that health from the hygiene is properly integrated, and also waste management. So moving forward, the so-called the top fourth step we have also taken is to ensure that we've developed some briefing notes in terms of looking at some of the key areas for inclusion, from integrated health and environment surveillance systems, early warnings, to ensuring that basic healthcare services, including emergency services, are properly integrated, disaster risk issues around One Health, and issues around sustainable waste management, covering both mitigation and also adaptation initiative. And then we also proceed to raise a letter from the office, the office of the country rep, led by Dr. Walter Kasade Molumbo, the Doubler of Nigeria, to the NCCC and the Minister of Health to really raise the issue at top eye level. And then following up that, we've also made some advocacies. We've had some panel discussions that are ongoing in Nigeria where our team were invited, and we have to leverage on those opportunities to raise our voices, including some linking communication. to ensure that there is a whole of all society approach for advocating or advancing health in the NDC. During all of these sections, we witnessed the visit of Mr. Simon, who is the Executive Secretary of the UNCCC in Nigeria. It was also an incredible opportunity for us to raise our voice and advocacy. And we'll also continue with that to ensure that we follow up with the consultants that were recruited by the UNCCC to oversee the whole of the approach. And we're also pushing all of this follow-up through the One UN team. So these are the key 7 steps we've taken so far. All right, so what are the enablers? Some of the enablers and tools that have been very useful in the whole of this work is the NDC guidance, which is on our website. And I want to really applaud the HQ team of WHO, as well as the entire attached team and the AFRO team for their guidance, which has been very, very instrumental. The Climate Health Vulnerability Assessment Report, the VA report launched in 2024 in Nigeria, also provide a very wonderful insight and evidence for action for advocacy. And that was a very powerful tool for us, which we've leveraged on it to also finalize the Health National Adaptation Plan, the HNAP. And prior to that, we have, during the HNAP process, we have also held meetings with 36 plus 1 state commissioners of health and the Department of Health of Directors of Public Health to really bring all of these issues around NDC, all the issues around VA down to the subnational level, and to enable them to understand and begin to instigate local action. The 4th point that have really helped us is to really get the buy-in of our top leadership. In most of the meetings, we have to make sure that the deputy rep of WHO and the rep of WHO in the country, as well as the rep of other partners who are working with us, are also raising the voices around this. And we also continue to leverage on digital space to raise discussions, working with different NGOs who are already making some advocacies and discussions, like the Health Watch Nigeria, the Nigeria Environmental Summit Group, and many other organizations within the non-state actors working in Nigeria. All right, so this is just to share some of the key lessons we've learned through the process. Is that we've seen the power of multi-sectoral dialogue. It can really help us to expedite so many actions. Climate change, of course, is a multi-sectoral issue, and health is just where pitching health is very necessary. But we can see that we can't work alone in the health sector. We have to mobilize support from different portals. We've also seen incredible lessons to see that top-level leadership buy-in at each country level is important to accelerate change. And another thing is the importance of evidence. The VA report has really made us provided an enabling environment, enabling resources for us to raise strong advocacy. And to culminate all of this, we have also piloted some greening, some installation of solar energy system in some primary healthcare facilities in some key states, giving some of the insights. So the VA provide that powerful opportunity for us to do that. Climate is also important to inform each and every one of us that the climate health space has evolved with more attention and many disruptions. We are seeing a lot of partners, a lot of people who are coming, and pulling all of this together can be very tricky when everyone is interested and they have a lot of competing interests. But the last thing that we have also found out is that we need a lot of work to do. We need to scale. We need more finances and investment at the country level now. And we also need skilled personnel, because there is an overwhelming work and an overwhelming attention within WHO asking to lead in this area of work and to be able to put other partners. So like many other programs, there is need for WHO offices, not just in Nigeria, to ensure that, to see how they can increase the human resource as well as also increase investment. So this is also a clear call for those who want to invest in Nigeria to also come in and support through our regional offices. All right, so this is just a track of some of the some of the key milestones we've recorded, looking at all the actions in the climate health space. And I want to applaud the HQ team since 2015, when the first climate health profile was developed in Nigeria. We've continued to push forward, and we've recorded quite a lot of successes in this area of work. Apart from the policy, also real issue of concrete improving energy systems within the health facilities and integrating the whole of the climate agenda into the whole health sector wide agenda, what they call the SWAP in Nigeria, with getting some tractions and funding support from some partners who are supporting our climate health agenda in the country. Next slide. All right, thank you. This is just a small of the picture of a health facility, which the country office, WHO, has been able to pilot in some of the states, in Rivers, in Akwa Ibom, and some of the actions leveraging from some of the work we are doing right now. The Honorable Minister of Health, Coordinating Minister, have announced that we have set up a national implementation committee for improving power in the health sector. And of course, there is a national summit, a national dialogue that will be coming up by July this year. And we want to use this medium to invite everyone to be part of it, which is part of the leverage or part of the opportunity that comes from all of this partnership and the work in the NDC and working with other sectors. And on that team, we also have the UNDP also working with us on that team, working closely with the government of Nigeria. All right, thank you. So this is just almost the last slide. Moving forward, what do you think? For us, we consider it expedient that every degree rise in temperature, of course, threatens a mother, a newborn, and also a health worker, as well as the entire health system. There's need for us to scale country efforts in climate health and environment. There's also need to increase demand for financing for health adaptation, as well as invest in human resource to address climate crisis within the health sector. We've also seen that there is also strong need moving forward to ensure that there's subnational implementation of the NDC health priorities. So we have started some level of engagement to make sure that it's not just about writing that there's NDC, writing health in the NDC and all of that. We're starting now to see how we can stimulate local action in the local government and state government budgets. How is climate change addressed, following all of the society approach? Of course, lastly, to mention that there is urgent need for us to embed climate-sensitive health indicators into both the UHC and also the primary healthcare system, which is the foundation of many health systems. Thank you so much at this point, and I want to say applaud everyone. This is some of the organizations working with us on the team. We have FCDO, Earthwatch, NCCC, Ministry of Water Resources, Ministry of Environment, NEMA, the entire UN team made up of UNICEF, FAO, and the rest of the team. Thank you very much for your great and rapt attention. God bless you, Rego.
Thank you so much, Dr. Edwin Ede. It's always the most interesting to hear how the NDC, how these things that we talk about are implemented at country level. And thank you we really appreciate you sharing your experiences. So we're running a little bit over time, but we do still have 10 minutes for questions. And I will hand over to our facilitator, Elena Villalobos-Prats. And have your questions ready, raise your hand, and Elena can take it from here. Thank you.
Thank you very much, Amy, and thanks to all the presenters for the excellent presentations. As Amy said, I think it was very nice to end with a country presentation on how this work is being implemented in the case of Nigeria. I hope everybody will facilitate my life, and then you will start raising your hands. If not, I see that there are many people connected. I see even Mauro. Mauro, I think I will put you on the spot. Do you want to share any experience that you are facing in Guinea, the kind of work that you are implementing? I think we have translation to French, so feel free to speak in the language of your choice.
Ok, merci Elena et merci tout le monde. nous, de notre côté, effectivement, comme le Nigeria est en train de faire, nous, depuis le mois de septembre passé, on a été contacté par la coordinatrice résidente du système des Nations Unies et pour nous parler du programme de révision de la CDN. D'abord, avant de commencer la révision, il était question d'abord d'évaluer l'ancien CDN 2.0, où nous avons participé à l'évaluation. Et à l'issue de ça, nous avons formulé des recommandations. Et donc, quand le gouvernement a saisi le système des Nations Unies pour appuyer, Madame la coordinatrice nous a contactés. Tout le système des Nations Unies, on est parti. Donc, il a demandé à chaque agence de voir dans quel domaine il peut appuyer. Et par exemple, l'OMS et l'UNSP se sont positionnés pour appuyer le volet santé de la CDN. Et la Banque mondiale s'est positionnée de financer tout le volet atténuation. Parce que la CDN, il y a deux volets, adaptation et atténuation. Donc, c'est la Banque mondiale qui va financer tout le processus qui concerne toutes les options d'atténuation au niveau de la CDN. Nous, au niveau du système des Nations Unies, nous, on s'occupe de l'aspect adaptation. Et au niveau de l'adaptation, ils ont dit qu'ils souhaiteraient qu'il y ait un volet santé. Et c'est sur ce volet-là que nous sommes en train de travailler avec l'UNSP. Et déjà, comme on a déjà notre rapport sur l'évaluation des références sur les émissions de gaz à effet de serre, et la semaine passée, nous avons procédé à la validation de notre rapport, la validation technique de notre rapport d'étude de vulnérabilité et d'adaptation. Et aujourd'hui même, on était au ministère pour voir comment nous allons mettre le processus en place. Et nous avons demandé de mettre en place un comité technique qui va regrouper les différents secteurs, les différents ministères, les différentes directions du ministère de la Santé avec d'autres secteurs. Ensemble, nous allons essayer de voir parmi les options d'adaptation qui ont été proposées dans l'étude d'évaluation des vulnérabilités et de voir qu'est-ce qui peut être priorisé. Et en plus, c'est que au ministère qu'on nous a fait comprendre, et l'année dernière, on a été touché par les fortes inondations où les infrastructures sanitaires, certains établissements de santé ont été touchés. Donc, le secrétaire général avait demandé est-ce qu'on ne pouvait pas inclure aussi les établissements de santé. Donc, pour ça, est-ce qu'on ne va pas organiser des missions pour aller voir quelles sont les structures sanitaires qu'il faut mettre? Parce que si on met les options de façon globale, OK, c'est bon, mais si on partait avec les options de plus en plus ciblées, c'était mieux. Donc, c'est là-bas où nous sommes et je les ai dit que oui, c'était une bonne option. Donc, nous sommes en train de travailler sur les TDR pour voir comment on peut aller et faire les évaluations au niveau des structures sanitaires, surtout dans les zones les plus exposées aux inondations, pour les intégrer dans le PNDS, c'est-à-dire dans le plan, dans la CDN. Je voudrais aussi vous dire que nous sommes en train effectivement d'évaluer, de mettre à jour notre PNDS, c'est-à-dire le plan de développement sanitaire qui va prendre 2025-2034, où nous avons plaidé et que les questions de changement climatique ont été intégrées dans tous les aspects du plan de développement sanitaire 2025-2030. Et il y a également le PANS, le plan national de sécurité sanitaire, où nous avons également plaidé, où également les questions de changement climatique ont été intégrées. Donc, tout ceci, nous pensons que tous ces aspects-là vont nous aider à canaliser quand même nos options et dans les options d'adaptation du secteur de la santé dans la CDN. Donc, ce que je voulais partager comme d'abord expérience, comme nous sommes le processus continu. Et là où j'avais des questions, et quand ils ont présenté, par exemple, l'outil Climate H, est-ce qu'il faut faire l'évaluation de co-bénéfices avant d'élaborer la CDN, ou bien est-ce on peut mettre déjà envisager des options qui peuvent intégrer, mais après qu'on fasse cette évaluation. Parce que moi, depuis Madrid, vous avez parlé de cet outil, mais quand on est venu, vous savez, ici, il y a on n'a même pas de données sur des données sur la pollution de l'air ici. Parce qu'en Guinée, si j'ai bon mémoire, il n'y a que l'ambassade des États-Unis, par exemple, qui a une station de mesure de contrôle de qualité de l'air. On n'en a pas, et donc, l'outil demande assez de données, assez de données, qui fait que ça va être un peu difficile, par exemple, pour nous d'appliquer cet outil. Sauf si, peut-être, s'il y a d'autres sources de données qu'on peut nous aider à avoir, donc ça serait mieux. Merci.
Merci beaucoup, Mauro. Maybe I will respond first, and then I will leave to Paolo, but maybe to also contribute to the response. From the overall perspective of the NDC, you don't necessarily need to wait until if you want to use a quantitative tool to assess potential health gains from implementing specific interventions, in this case, and policy options, in this case, related to exposure to air pollution. You don't need to wait, because if I understand correctly, you are going to focus mainly on adaptation. So you can go ahead and integrate everything related to adaptation, to resilience. And then I understand also that the time frame is quite short, that you need to deliver your input quite soon, because the NDC needs to be finalized soon. So again, there are even different ways that you can advance, and you could even opt to go for a qualitative approach without necessarily needing to use this tool. Because again, Pierpaolo can provide more insights into this. Of course, this is the ideal scenario, that we have time and resources to use the tool. But our experience is that in some cases, I mean, you need a lot of data, you need a lot of capacity, you need a lot of time and resources to do this. But again, maybe Pierpaolo, you can jump in and also respond to the question on data availability and the use of the tool, and any potential advice that you have. Are you still there, Pierpaolo?
Yes, I agree with what, thanks for the question. I agree with what Elena was saying, that you don't need to wait to get data to, I would say, start making decisions, or also start making some political analysis. Obviously, if you have data and information, the situation is much better, because you can have some kind of reference for changes when you do modifications. Shortly, climate change, we had experience with the colleagues of climate change in headquarters of application in Pakistan. So I can quote a country where the data were not abundant, and so there was not abundance of data. And I have to say that the software exactly requires you to start making the point of the lack of data, or the availability of data. And at the moment, there is no, I would say, there's no single country where you cannot get some data. You can get satellite data, for example. But as Elena was mentioning, this requires some people spending time on this. It's not that tomorrow you get this data and you already do the analysis, something that we can do for France or for England. But in your case, obviously, it takes longer time. But it's a time that I think is worth spending while doing some analysis, as Elena was mentioning, and then pushing the sectors to do their job, to produce the data and to give this data transparently available for the public. I hope I answer your question, but in the manual there is an example there where you can understand what kind of data you can work with, and in the links in my presentation, you will check also the case of Pakistan and Colombia. Thanks.
Thank you, Pierpaolo. Unfortunately, we are running out of time, so I hope the last two hands that we have can be short in their interventions, and then we can go to the closing of the meeting. Sorry, Swati. Do you want to go ahead?
Yeah, thank you for this presentation, and thanks to Edwin from Nigeria for kind of talking about the step-by-step process taken to develop an HNAP. I'm curious, as maybe from Edwin or others to hear, in addition to WHO documents, have there been other sectoral guidances that have been useful in developing the HNAP or the health chapter in an NDC? And this will be helpful for us as a technical partner to know exactly what kind of knowledge gaps need to be filled. What kind of information is actually being asked by the ministries themselves. Thanks.
All right. Right. Thank you. Thank you, Swati, from yourself and the other colleagues who have write some questions. I can see Samuel and Fleming from Netherlands. Thanks for all your questions. So in addition to the WHO guidance, there are a lot of other consultations that has been done and other documentation that has been done in developing and integrating health into the NDC, as well as the HNAP itself. You can also attest to the fact that Nigeria right now has some data around the determinants of health, especially meteorological data from NIMET. You're also aware that we also have the health sector blueprint, which sets about 4 major strategic direction of the health system in Nigeria under the SWOP agenda. All of this with the recently published State of Health report in Nigeria, together with the findings from the VA. And you know that the VA itself was done in consulting and collecting both primary and secondary data from different states in Nigeria across the 6 geopolitical zones to ensure that reflection, because the climate in the weather in Nigeria is there are different climatic zones within the country. If you go down south, of course, there is more raining season. If you go down to the north, you see more of Sahel. So all of this triangulation of information we are put into consideration and ensure that it don't just reflect health from a one point of view, but it's from a holistic approach to health, preventive, curative, and all of that. So that is that. And if you permit me, I can just respond to other comment raised by Fleming and around some state level actions. That's what are some of the real evidence or the real product of the VA HNAP report in Nigeria. Okay, so the report itself and the HNAP provide a very useful information for advocacy. And that was actually a really game changer, because the launching of the VA during the JAR, the joint, the JAR in Nigeria by the Honorable Minister, actually pulled up the issue to a more high level. And with that, now we are seeing that in some of the states, there is a rapid infrastructural improvement. People are trying to retool some of the health facilities to make sure that it's climate resilience, there's greening and solarization activities. Last 2 weeks, we got a call from Abia State that is also Akwa Ibom State is also taking some solarization of some of their PXCs. In addition to that, now the NDC, the NCDC, which is the center, the Nigerian CDC, Center for this Control, is actually working together with NIMET to ensure that meteorological data is integrated into the disease surveillance system in the country for meningitis and for many other things, as well as ensuring that some of the programs like NCD programs, non-communicable disease programs, malaria programs, and other programs are beginning to align their programs and agenda in line with climate change. So these are some of the things in addition to opening the finance space through the climate change agenda. Thank you. Over to you, Elena. If there are other things, you can proceed.
Thank you, Edwin. Margarita, I don't see your hand anymore. Just to confirm whether you want to go ahead or not.
Hola.
Hola.
I speak English, Spanish. No, sí, brevemente, muchas gracias. Ha sido muy interesante todas las herramientas que nos han presentado. Yo solo quería preguntar un poco en la línea de Swati, ¿qué otros organismos, además de la OMS, pueden apoyar a los países en desarrollo para ese tipo de análisis de medidas para la NDC, de pérdidas y daños. Nada más eso, y muchas gracias por la invitación.
Thank you, Margarita. I think there are many experts and even academia that are using the tools that you've been presented with at Pierpaolo. He was already presenting some of the experts and the papers that have been developed. So maybe if you're interested in a specific tool, we can give you more information about that. Just feel free to send us a message. With this, I think I will just go ahead and close the meeting. I've been mandated to close the meeting on behalf of Dr. Diarmaid Campbell-Lendrun. And I think that it has been quite motivating to see all of the participants. We had almost 250 participants connecting in the morning and afternoon sessions of this webinar, many countries. So this is a recognition that there is interest by countries. There is more and more ministries of health interested in making sure that health is included into policy processes and reporting processes under the United Nations Framework Convention on Climate Change. There are tools available. We just saw the presentation by our colleague Pierpaolo. It was just one, but there are more tools developed by our colleagues in the air pollution team and the air quality team that can be used to quantify health gains. We have many tools to integrate everything related to the other quality criteria that was presented by our colleague Brahma. There is not too much time, but WHO is available to support countries to make sure that health is integrated into their NDCs. If you are from a country and you need support, for example, from Uruguay, we will be happy to connect you with our colleagues in the Pan American Health Organization that are also supporting countries there to do so. So I think the presentations by countries probably are the most relevant, again, because they all reflected in the collaboration that is happening at country level. You have this interest and this request by the ministries of health, and then you have WHO colleagues involving also other UN agencies and other partners around the need that and the support that ministries of health are requiring. And this collaboration is also showcased with a nice collaboration that we have with UNDP under the Climate Promise. They are responsible for bringing together all of the expertise and the UN partners that are available to support countries to integrate, to advance in their NDCs. And basically, as WHO, we are contributing with the health expert inputs. So that's it from our side. Thanks a lot, and we will be organizing more of this based on your request. And thanks to Amy and all of the team that has been presenting and putting together this webinar. Amy, any final remark?
No, thank you to everyone. Thank you to all the speakers. And it's really great to see the health community moving forward and integrating health and NDCs. And we will obviously continue to do so. I've put the email address in the chat if you have any further questions or would like to suggest any future webinars. Thank you, everyone, and have a great afternoon or day wherever you are.
Merci, merci.